Hey guys, it's Dr. Aaron Gum, founder of Blueprint to Practice Automation, yourautomatedpractice.com. Today I want to talk to you about what's called value-based communication in the consultation, okay? So what do I mean by value-based communication? Well, when I talk about values, it means that you got to really have conversations around that patient's values, what they want out of the program. Every single person that walks through your door, okay, has a very different reason of why they're at your clinic, what their condition is affecting their life, how it's affecting their life. Every person has their unique value of what they want out of the situation. And you really got to figure that out. So let me tell you a story about this. We had a client with Blueprint to Practice Automation, and his close rate wasn't very good. He was closing about 30%. He didn't know what he was doing wrong. We have all the training in our platform, and obviously that client wasn't going through our training, and we could check that on the back end. But long story short, I said, record your consultation and let me listen to it, okay? And this guy, let me kind of preface what type of doctor this is. Very high clinical research, those things valued to him, all the research, all the clinical, very doctorish type of personality, which is fine, but there has to be a very good balance in that consultation, or you're gonna really talk over the patient's head and really push them out of the process. And they're not gonna feel that you understand them when you just keep pounding them with philosophy, research, the technology that you use in your office, how it benefits them. They wanna know how they're gonna get their values back. What do I mean by that? So when that patient walks in the consultation room, instead of talking 90% clinical and symptoms and 10% how it's affecting their life, we have to flip that upside down, and we got to talk to the patient 90% of what they want out of the program and how it's affecting their life, and 10% clinical, okay? Now this doesn't make you less of a doctor. It doesn't make you that you don't care about clinical and that you don't know what you're talking about. They already know that you know what you're talking about. They wouldn't be sitting in your office. You don't need to prove anything to that patient of how well you know your philosophy or how well you know the technology or the research behind it or the scientific studies. They don't care about jack about any of that stuff, really. All they care about is a few things. They care about if you care, if you can help them, and that you understand them, okay? So really asking them questions on, Mary, how's this affecting your life? Now, don't ask it very generalized where, okay, you're in pain and you can't sleep. You got to really dig deeper, okay? You say you're in pain and you can't sleep. Now, how's that sleep affecting your day, the next day? Well, when I go to work, I'm exhausted. I can't get my job. I can't get my work done. My boss is frustrated. Oh, so you're telling me that by not being able to work properly and getting your job done, your boss is frustrated. You're saying that maybe long-term your career could be on the line because of this condition. Of course, okay, of course my career's on the line. So you really gotta dig deep and dig deep and dig deeper and really spin off of everything that they say. Now, when you repeat those things back, make sure you use their emotional words. If they say I'm in excruciating pain and I can't sleep, say, okay, let me get this straight. You're in pain, you're in excruciating pain, you can't sleep, that's affecting your next day, you can't get your job done, your boss is frustrated. Because by repeating exactly what they say, they're gonna understand that you understand them, okay? That's one down. They know that you understand them, okay? So by the time of that conversation's done, and then you get a good grasp on what's going on, that you feel like you've connected with them, with their emotions, with their condition, then you can move on to all the clinical things, okay? So along the way, let me kind of give you two key questions you need to be asking this potential patient. One is, whatever they've tried in the past, you need to ask them why they think it didn't work, okay? Not because you want to see if they understand, but you want to get them to think logically of, okay, I've tried gabapentin, Neurontin injections for my neuropathy. You need to ask them, why do you feel like the gabapentin, Neurontin, and injections did not work for your neuropathy? And just be quiet. Let them kind of work through this question. Well, it's probably not going to fix it because there's deep-rooted issues that are causing my neuropathy and it's just a Band-Aid. Now, is that answer going to be perfectly every time like that? Of course not. But what you're doing is you're getting that patient to think about logically of why that isn't the solution, okay? Because in the report of findings, you're going to bring that back, okay? So you got to get them telling you why those things didn't work. Another question that I always see that works in the consultation is I always ask them, you know, if it's a low back issue or a knee or a neuropathy, whatever condition it is, I ask them, Mary, what do you think is going to happen for me to get you feeling better or correcting this problem? How long do you think that's going to take to get you feeling better versus correct the problem? That question really just separates the two models, okay? Medical model, corrective model, okay? So they're going to think through that question and say, we'll probably have had this a long time, so it's probably going to take a while to actually fully correct this problem. Now, is that answer going to be perfectly every single time? Of course not. But majority of the time, that patient's going to end up with some type of assumption in that a line of words that I just said. That's going to get them to think, well, it's going to take a long time. This isn't a quick fix, okay? Because in the report of findings, you're going to bring that back as well. When you recommend a time period and say, you know, it's going to take me 90 days to get you back to where you want to be, that logically is going to make sense to them versus never ask that question and then ask it and then tell them in the report of findings of it's going to take 90 days. And then they have to work through it in the report of findings, and that's going to give you an objection in that report of findings. So we got to start uncovering these things in the consultation thoroughly. So when the report of findings comes, you're just kind of really rehashing the consultation, giving them a time period of it's going to take them to get them better. And then the report of findings is just going to be a formality. So value-based communication, you really got to focus on how it's affecting their life, really dig deeper in that consultation so you can connect with them that way. So I hope this topic helps, and really just think about your consultations. You know, if you're spending 90% of your time talking about symptoms and research and clinical and philosophy, try to flip it upside down and do it 90% on the values and how it's affecting your life and only 10% clinical and OPQ RST, and see what happens. Just experiment. So I hope that helps, and we'll talk to you soon.